1 in every 8 women will get breast cancer in her life. Breast cancer happens when mutated cells with damaged DNA attack and invade healthy cells. These cancer cells over-reproduce and create lumps and growths and tumors. Then these mutated cells leak into the bloodstream and the lymph system and can damage other parts of the body, especially the bones, liver, lungs, and brain. When the cancer moves from the one area to the other areas, it's called metastasis. It is estimated that yearly 220,000 women will be diagnosed with breast cancer, and that 40,000 will die. 2,150 men will be diagnosed, and 410 will die every year. Cancer has been around since the beginning of recorded history, and probably way before that as well. There's this ancient Egyptian textbook about treating trauma from 3000 BC. In this book, they recorded 8 cases of breast cancer. They tried removing the tumors by castration, using a tool called the fire drill. In this book, they wrote, "There is no treatment." Roughly 2,500 years later, the Greek physician Hippocrates, aka the father of medicine, named these tumors carcinos and carcioma. These are the Greek words for crab. Then in the 1st century, Roman physician Celsus translated the name from Greek to Latin. This is how we have the name cancer. Fast forward to the Renaissance. In 1761, Giovanni Morgagni of Padua did autopsies to specifically study cancer. He would be considered the first oncologist. Then in the 19th century, cancer research and research of the body in general really took a step forward. Scientists were learning new things all the time, and this has continued up to now, like they're still learning new things all the time. Currently, researchers are working on treatments and looking for a cure. Breast cancer mostly affects women, but men can also get it. Everybody is born with breast cells and tissues, so everybody has a chance of getting it. Women just get it a lot more than men do. There are some risk factors, like women older than 55 are more likely to be diagnosed, and women who got their period before the age of 12 are also at higher risk. Those are risks that you can't really do anything about, but there are also environmental risks, like lack of physical activity, alcohol abuse, and combined hormone replacement treatment. But 60 to 70% of women who have breast cancer have absolutely no connection to these risk factors, and a whole bunch of people who have these risk factors never get breast cancer. There are 14 different types of breast cancer, and the most common is DCIS, ductal carcinomia in situ. In the description, you can learn about all the forms more in depth. Symptoms of breast cancer are lumps, swelling, and skin discoloration in the chest area, abnormal flatness or indents in the chest, changes in the nipple discharge, chest pain, and a marble-like appearance of the skin. Doctors suggest that women do a self-breast exam every month and have an annual mammogram. Because if breast cancer is caught in the early stages, it can be prevented, and the patients can continue on living their lives almost normally. Breast cancer is officially diagnosed with a mammogram, ultrasound, MRI, biopsy, and/or lab tests. As a part of the treatment, the patient will have a team of doctors, specifically oncologists, working with them. There are standard treatments like surgery, radiation, hormone therapy, chemo, and more targeted treatment. And then clinical treatment specifically targets the individual's cancer. There are links below to learn more and to donate to breast cancer research, and I will see you guys in the next video.